Hi, I'm Casey Imbergamo. I'm an orthopedic surgeon, and I earned my medical degree from Rutgers Robert Wood Johnson Medical School. While I was at Rutgers, I served on the admissions committee, where I was involved in evaluating and interviewing prospective students. I did that for 3 years there, and I've been involved in counseling and advising students for almost 10 years now. Outside of clinical care, it's probably one of my favorite aspects of being involved in academic medicine. I graduated summa cum laude from Seton Hall University for undergrad with a bachelor's degree in biology, and at Rutgers Robert Wood Johnson Medical School I was selected for Alpha Omega Alpha, or AOA, which is our honor society, and at both schools I was fortunate enough to get academic scholarships. So success in medical school is definitely multifactorial, but if I had to pick one key to success, I would say it's learning how you learn best. So everybody has their own way that works for them. You just have to figure out yours. For some people, it's flashcards. Other people, it's handwritten notes or recorded lectures on repeat. It varies from student to student. And you can spend all the hours in the day going over material, but if you're not studying in the right way for you, you'll be spinning your wheels to some extent. So then once you learn how to study efficiently, this makes medical school much more manageable, and it's a skill that you'll just carry with you for the rest of your career in medicine. I think there are so many qualified applicants each year that have great GPA, great MCAT score, great clinical experiences. So I try to help find what's unique about each individual student and then create a narrative and an overarching theme for your application to help you tell your story that appeals to the application reviewers. I would say my greatest strengths as a consultant would be that I have formal experience in how U.S. med school admissions committees evaluate and score applicants. I went through formal training on that when I was part of the admissions committee at my medical school, and beyond that I have a pretty long track record of helping a number of students get into U.S. medical schools from all over the country and then to a variety of schools throughout the country as well. So I am passionate about medical school admissions consulting because I was the first person in my family to pursue higher education, especially anything in the medical field or medical school in particular. So when I made the decision to apply to medical school, I had a lot of questions. I did a ton of research throughout the process myself, and it definitely would have been nice to have some guidance, especially from someone who has perspective, both having gone through it themselves as well as from the other side of the curtain as an admissions committee member. And I tell all my students this, but I've gone through the gamut of medical training at this point, all the med school exams, step 1, 2, and 3, residency and fellowship interviews, orthopedic surgery board exams, and in my opinion, still the most stressful aspect of the entire process was getting into medical school. And that's the real rate limiting step. So I want to help students overcome that and get their careers in medicine started.